So we start with sharing, and then I'm making it full screen. Can you see the presentation full screen?
Not full screen.
So I need to do it one more time. Okay.
Yes, okay.
Okay, good. So the Socrates model, and we were speaking about this. And now let us just have a look how this model works in the conversation with a doctor, with a patient, I mean, when a doctor talks to a patient. So we're going to listen to Dr. Martin talking to his patient, Mr. Wood. And so before we start listening, I would like to be sure that we understand everything. So these are the the abbreviations that are commonly used by doctors in the history of patient complaint. And so let us have a look at them and just decide what they stand for. The first abbreviation, number one, is for Abdel Rahman. What do you think it means? Abdel Rahman, hello? Looks like he's not with us. Hussam?
Yes, the pressure of his heart rate or his blood in the vessels is 100 rating per minute.
Yes, 100 beating per minute. Yeah, this is the rate of his pulse. Okay. And so Abdel Rahman, you are here. What about abbreviation 2? What do these letters mean? BP. Abdel Rahman?
JVP.
Yeah. Any ideas? Yes, who can help us?
Muhammad Abu Ali. PB, it's mean blood pressure.
Yes.
Is 100/70 millimeter of mercury.
Of mercury. Right, great. So the next is for Amar, please.
The GVB.
Yeah.
Yeah, the GVB not relevant. It's the presence of venous hypertension.
Yes, actually this is jugular venous pressure. Yes, it's not elevated. Well, the next is for Anurin. Anurin?
CNS,
Uh-huh.
central nervous system.
Number, exactly. This is just no, I mean, this is the system. We are speaking about number 4. CVS.
Number 4.
Yeah.
Yes.
What kind of system is it?
CVS.
Yes.
Mhm.
So Emma, can you help us?
No apparent distress.
CVS. Which kind of system is it?
It's non-apparent distress.
You are speaking about NAD. This is no abnormality detected. Yes. 3 students just.
Doctor, can I say?
Yes, please.
CVS. Cardiovascular system examination.
Exactly. And no abnormality detected in cardiovascular system. The next is for Isa. number
Is it
five.
number 5?
Right,
Yes. It is on examination.
exactly. Once we've already seen this abbreviation. Abu Ali, please, next one. Read it, number 6. And Abu Ali, hello.
Yes, teacher.
Mhm.
Yes, teacher. Carpitation.
So number 6, will you read the phrase, please?
Yeah. Number 6 is whispered early inspiratory fine carpitation.
What does crepitations mean? And where? Yes.
Pectoral crackling
Mm.
or grating sound around the lungs.
Okay, yes. Mhm. Thank you. The next is for Mohammed Ali, please. Number 7. Mohammed Ali.
Yes, doctor.
Mhm. What does it mean? Audible.
Audible.
Is it connected with sound? Yes,
Yeah,
Noha.
yeah, connected with sound. Right.
Noha, what would
It's
you
loud enough to be heard.
Yes, Noha.
Audible?
Yes.
Yes, audible means audible means that it's heard or it's capable to be heard, heard in spoke and in the audible voice.
Okay, so awesome sounds about sounds.
Yes.
About the abdomen, it's normal, and the last abbreviation number 9 here, CNS, we've already just said this. This is central nervous system, and NAD stands for no abnormality detected. So actually, the meaning of the phrases, the meanings are given here. So you may have a look one more time just to remember. I would like you to just write down the abbreviations and the meaning of these abbreviations, just so you should remember them better, because at the end of this period of 5 weeks, we are going to write the test, which will include everything that we've covered during these 5 weeks. And about crepitation here, a particular cracking, crinky, or grating sound around the lungs. So you've said about this. Anyway, you can find the presentation on the Moodle site. Just if you didn't get all the information correctly, or just look through the presentation one more time after the class. And so now
Listening 3.
we are going to listen to the part of a conversation between Dr. Martin, a doctor in accident and emergency department, and his patient, Mr. Wood. As you listen, please make your own notes about Mr. Wood's presenting complaint. Then we'll discuss the conversation. So I am going to turn it on, and you should say whether you can hear.
Listening 3.
Can you hear?
Yes.
Okay.
Listening 3.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the center of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
Okay. I'd like to ask you some questions.
Well, so just this is the information, and in case that we've missed something, or just to be sure that we understand everything, I would like you to listen for the second time, but now looking
Listening 3.
at the script of the conversation, so you can compare what you've learned to what you understand from the first listening to the real information, and how just well you can understand the information. Now we are going to listen for the second time and look at the script just to understand it better, and then we'll discuss.
Listening 3.
Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
Okay. I'd like to ask you some questions.
Well, so I think
Listening 3.
we can understand it better. Yes, Amar would like to just to say what he understands from the listening. Yes, Amar?
I got another question. What is the dull pain?
Sorry?
The dull pain.
Okay, where is it? Dull pain? Dull?
Yeah.
Okay. Dull pain is not a sharp pain. Dull is the opposite of sharp. It means that the patient feels the pain all the time, but it's not very strong. This is dull pain. Do you see? Okay.
Yeah.
So now let us just focus on what we've learned from this conversation. Rufaida, will you just tell us what you do understand about Mr. Wood condition? Rufaida, are you here?
Yes, he has pain in his chest and the left shoulder.
Okay. What else?
And he has shortness of breath and dull pain. He feels sick and weak.
Okay. Okay, so thank you. But does anyone else want to add anything? Tariq, what else did you understand from the conversation, from the listening?
Yes, doctor. About the pain, the description of the pain is like squeezing. It's not very sharp. The pain started when he was bending over in the garden.
Okay. Okay. As for the first question here on this slide, can you answer this question, Tariq?
What does Mr. Wood do?
About his job, his profession.
Oh, yes.
Who remembers?
Bus driving.
Exactly. He is a bus driver.
Yes.
Bus driver. Okay. So, the next question is for Emma about the Socrates model. So, does Dr. Martin? Yes.
Socrates model, you mean the critical thinking question that he asked, or what?
So I mean that does the doctor follow Socrates model, like he asks the question that this model suggests?
I think he asked what is the time he got the pain, and also does the pain spread from place to place? Also, he asked do he have history of a history, or what he take before he come to his hospital? And also he asked him to describe the pain.
Exactly. So he follows the model like as about the site, about the on-site, then about character, about associations of and everything. Yes, he follows this model. Okay. So the next question is for Yasmin, please. Read it.
Yes. What is the correct diagnosis for the shoulder pain? I think it's angina pectoris.
So if it is angina pectoris, is the main pain only in the shoulder?
Also in the chest.
In the chest. Okay, and it irradiates to the shoulder, right?
Yes.
And so good. And Abdul Rahman, the last question, please.
What is the immediate treatment for this disease?
Mhm.
If it's actually angina pectoris, so it's nitroglycerin.
Mhm. And actually, so the painkillers that the doctor offers to the patient at the beginning of the conversation, right? So, and as for the shoulder pain, when the patient, Mr. Wood, felt this pain for the first time in the shoulder, what did he do?
He rubbed some liniment on his,
Why did he
shoulder.
use the liniment? Why did he do this? What
Because
kind of
he thought he had a touch of arthritis.
a touch of arthritis? This is also possible. Just diagnosis for the shoulder pain. Okay, so good. So let us move on, and I would like now to focus on some grammar aspect of the conversation, and so let us focus on the tenses in the presenting complaint when the patient talks to his or her condition. So understanding the time patients are referring to when they speak is crucial to making a correct diagnosis. And we should focus on the present tenses today. The present simple, present continuous, present perfect, and present perfect continuous. And what is the difference? What kind of action does the verb in the present simple describe? So when do we use the present simple tense?
Like something that is okay.
Yes.
Should I answer?
Yes. Yes. Sure.
Something that is happening just now and just finished.
Are you speaking about present simple?
Yeah, something that's true at this moment of speak, like just now happened.
I see. Yes. Some just everyday actions, for example, right? Well, what about the present continuous tense? What does this tense describe?
Doctor, present
Yes, please.
the fact.
Will you repeat, please?
Yes, present simple describe the facts also.
I see. Yes, some common facts.
Also describe fixed schedule, like timetable.
Yes, that happens regularly.
Yes.
Now,
habits.
Yes, the habits. If we move to the present continuous, so what does the verb in the present continuous, what kind of action does it describe? If it is used
something
in the...
that happens at the moment.
Yes, now at the moment of speaking. Okay, and which is in progress now. What about the present perfect tense?
Also, the present continuous something that is arranged for the future date or our.
Exactly. Yes, for the future. So some kind of something which is scheduled and which will happen. Which will probably happen in the future, right? Okay. The present perfect tense, please. Any ideas?
Something that happened in the past and has effect now, or describing between. No, not present perfect.
Yes, and has some effect or result in the present.
Yes. Yes.
It may have finished by the present moment or may still go on. Okay, but it has some result. And the present perfect continuous.
Doctor, the present perfect continuous, it describes an action or a situation that started in the past and it's continuous in the present.
And it emphasizes that the action was in progress for some period of time. So,
Yes.
okay. Good, great, thank you. Now, this is just the summary of what you've said with some examples about the present simple. So this tense is used to talk about something that is true at the moment of speaking, like I feel better, the patient says. Something that is happening on a regular basis around now. I get these headaches in the morning, every morning, so regularly. And it can also describe a process. When I lean forward, the pain goes away. The pain starts in my chest and moves up to my shoulder. Okay, this is just relating to the patients. And here is the information about the present continuous tense. And this tense is used to talk about something that is happening at the moment of speaking, like his blood pressure is rising, present continuous. I'm having difficulty breathing, am having. So the next is something that is happening around now, though not necessarily at the moment of speaking, like in the examples. Are you taking any medication? Not now, this minute, but this week, for example. Are taking, this is the verb in the present continuous form. Or I'm having chest pains currently, so like I'm having. And the next function is something that has been arranged for a date in the near future. Like in the example, I'm seeing a psychotherapist next Wednesday. It means I've arranged the meeting with a psychotherapist, and it will happen next Wednesday, 100%. So, as for example, the use of the verb have in the present continuous, to refer to the moment of speaking, it is more limited than in the present simple. It means it is generally restricted to expressions such as have difficulty. If, for example, have is used in this meaning, we can use it in the present continuous tense. Or have something to eat or have a shower. But in the meaning of possession, so have is not used in the continuous form. It should be used in the present simple form. So there is a group of words that of verbs that are never used in the continuous form. You remember them. Well, and there are two examples to compare. Moment of speaking, I've got a pain in my chest, and around now I'm having pains in my chest. So there is a difference in the meaning of these sentences, of these forms. And the next is the present perfect tense. So we use this tense to talk about a situation that begins in the past and which either continues up to the present or is related to the present in some way. It does not tell us how slowly or how quickly something has happened, only that this is the way the situation stands now. In the example, my headaches have decreased. So by now, for example, we see there is some result in the present, the decrease of headaches. So that is why this form, the present perfect tense, is used. It started in the past and it has decreased. And yes, the present perfect continuous, we use this tense in a similar way to the present perfect, but the continuous form describes a progressive change in a situation up to now. My headaches have been decreasing for the previous week, for example. So we emphasize that it was not, it was a long process just. And actually here on this slide, you can see the diagrams. They are given to the left. So which diagram stands for, shows the so the grammar forms of the verbs. For example, the first is the present simple. This is like something that is true now on the timeline. The second is for present continuous, something that started in the past and is in progress now, and it will last for some period of time in the future. And this is diagram number 2. Then diagram number 3, present perfect. There's the action which started in the past and has some effect now, we can see. And diagram 4 stands for the present perfect continuous. It's the same as the present perfect. It started in the past and it has some effect, some result at present. And it's very important for how long the action lasted. And it can also be in progress now for some time in the future. And the task here is to match the sentences and the diagrams. The question, which diagram does each sentence relate to? So let us listen to Mohammed Ali. The first sentence, please, is for you.
Doctor?
Yes.
Sorry, but I have an appointment at the hospital after 30 minutes, so I have to go. Is it okay?
Okay, yes. So, yes, but don't forget about the home assignment, okay?
Yeah, for sure.
Okay. Well, so let us listen to Noha. The first sentence, please.
I have got a headache, and this tense is the present perfect tense.
The present perfect tense, actually, yes. The form of the verb is present perfect, but the meaning is like I've got. This is the about the. Okay, this is simple, maybe, yeah, the meaning. Okay, so the next sentence is for Faida. B sentence, please.
I've been having this shooting pain in my leg. Present perfect continuous.
Exactly, right. Okay, Tariq, please, C sentence.
Yes, I keep getting these flashing lights around my eyes and a sharp pain. Present simple.
Present simple, keep the basic form.
Continuous.
No.
No, simple.
Simple. Keep the word which is highlighted is used in the present simple. Okay, Emma. Emma, please.
I have been having those terrible backache. I think it's present perfect continuous.
Exactly, it consists of 3 words. Yasmin.
The pain goes right through you. It's a present perfect. Present simple, sorry.
Present simple, exactly. Abdel Rahman, please.
I'm getting these headaches off and on now. Present continuous.
Yes, I'm getting, this is the present continuous tense, but you missed F. Now F, please, Hussam. Hussam, are you here?
He just left for the appointment, doctor.
I see. Amar. F sentence F.
Have you been having any pain? It's perfect. Perfect tense continuous.
Present perfect continuous. Okay. So Anurin sentence H, please.
I'm not taking anything for them. It's present continuous.
It's present continuous, exactly. Well, Isar, the last sentence is for you.
The attacks have increased. Present perfect.
This is the present perfect tense. Good. I'm so glad that you can easily recognize the tense forms of the verbs because the home assignment will be connected with the use of the present tenses in the sentences. Well, let us move on to the next slide. And here we can see the sentences which we need to complete with the correct form of the verb. If more than one tense is possible, we can use it and explain the difference. For example, the first sentence, let us listen to Abu Ali, please. The first
Yes,
sentence.
teacher. My mother has been having this pain since last Tuesday. She still has them.
Exactly. So it's better to use the present perfect continuous because we have the preposition since. It shows that the perfect form should be used. And if she still has them, it means that it is in progress, has been having. Okay, good. Well, the second sentence, Noha, please.
Okay. Do you normally go for a run at the same time every day?
Yes, this is about everyday action, normal action. So everyday action. So that is why we should use the present simple. Exactly,
Yes.
you're right. Okay. Rofaida, please. Sentence number 3.
The pain have been eased a little since yesterday.
Do we need to emphasize the process? Do we really need a continuous form? I think present perfect simple is okay. The pain has, Rufaida, has eased. Yes, a little since yesterday, has eased. Okay, so let us stop here because we have less than 1 minute and we'll continue in 10 minutes after the break. Okay.